Hello everyone, my name is Isabel, and I'm going to talk to you a little bit about what nursing is to me. These past 7 weeks have gone by so quickly, and it amazes me to think about everything I have learned in such little time. I will never forget the little moments that have made me even more excited to become a nurse. Listening to my lab partner's apical pulse for the first time with my stethoscope was incredible. I also finally learned how to use a blood pressure cuff after having my blood pressure taken at the doctor's office numerous times and wondering how it worked. Also, I will never forget how I felt the first time I gave a patient an injection or did a bed bath at clinical. These are all things I never pictured myself doing, and these are all just the little parts of nursing. There's plenty more to learn and skills to gain, and I'm looking forward to it. For the next 3 to 5 years of my career, I see myself moving to North Carolina to work. I have grown up in Buffalo and I love it, but I think it is time for me to start a journey somewhere else and have a change in scenery and weather. It is not too far, so I can always come back to visit my friends and family. And my grandmother and my mom are thinking of moving there too, so who knows, maybe we will all end up there. I am not sure what area of nursing I would like to go into yet, but oncology has always been an interest of mine, as well as mental health nursing, so based on how clinical rotations go in the upcoming semesters, I can see what is the best fit for me. I see myself being a floor nurse for a few years and then possibly going on to be a nurse practitioner. After doing my surgical rotation at Sisters Hospital, I realized that I enjoyed the smaller atmosphere compared to Buffalo General. In a smaller work setting, everyone knows each other, and I like that it gives off a family-type feel, which is what I hope to have at the hospital I work at in the future. My philosophy of nursing involves providing optimal patient care while maintaining patient safety and promoting health. I want to make the patient's recovery process as least painful as possible and make their stay comfortable. When I am a nurse, I will take the extra time to safely administer medications and to have good hand hygiene so that I do not pass on any infections. I will also incorporate patient teaching about healthy lifestyles and how to manage present diseases so that conditions do not get worse. I believe that it is important to take control of your health and be conscious of what you do and how your lifestyle affects your health. I think that Dorothea Orum's self-care deficit nursing theory relates to my philosophy. Her theory has a developmental perspective where self-care determines a person's health, and nurses are needed to help people who have self-care deficits. When a person cannot be entirely independent, they have a self-care deficit. Nursing interventions can be very involved, partially involved, or simply support and education, depending on the self-care deficits the patient has. Orum's theory encourages people to be as independent as possible and that people want to care for themselves. It is important to encourage patients to be independent because once they leave the hospital, they may not have as much assistance and support at home. Nurses and patients work together to overcome these self-care deficits and to live a life as normal as possible. I do not see myself joining a nursing association in the first couple years of my career because I want to first be comfortable being a nurse because I think that with experience I will have more to contribute to the association and will get more out of my membership as well. Although I will not be in a nursing association my first few years as a nurse, I will still make sure to be aware of current issues in healthcare and policy making. Nursing to me will be more than just a job where I go to work and go home while ignoring what is going on in the world that affects my career. I am glad to have been exposed to what associations are and the benefits offered by these organizations, such as networking and events. After exploring the Palliative Nursing Association in week 4, I believe that when I do join an association, it will be one related to the area of nursing I am doing, since I will most likely share the same mission as that association. I see nursing as more than just a practice. According to the Oxford Dictionary, practice is defined as the actual application or use of an idea, belief, or method as opposed to theories about such application or use. Nursing does not incorporate just any random methods or skills, but instead uses evidence-based research to determine what nursing interventions are effective and why. I consider nursing a discipline since it uses skills that have an educational and theoretical basis. There is a code of ethics in nursing and ongoing research that focuses on improving healthcare. Nurses do not simply learn skills and perform them. They utilize certain interventions based on the patient's diagnoses and then evaluate to see how the patient reacted and whether these methods need to be altered in order to reach desired outcomes. Some contemporary issues that I will be facing in practice environments include the nursing shortage, mandatory overtime, and medical errors. For the past few decades, the demand for nurses has greatly exceeded the supply. Recently, the aging baby boomers, chronic health conditions, and the increase in average life expectancy have contributed to the high demand of healthcare services. To help relieve the shortage, some states have implemented mandatory overtime so that if a nurse has completed her shift but there is no nurse to care for her patients once she leaves, she is forced to stay. Studies have shown that nurses working more than 12 hours straight leads to medical errors and can put the patient at risk. The Institute of Medicine brought the attention of the high incidence of medical errors in the United States in the study to err is human. Most of these medical errors were caused by faulty systems rather than attributed to one person's mistake. To address the nursing shortage, I plan on being a nurse for many years and encouraging others to consider nursing. I did not plan on being a nurse, and it wasn't until I became friends with students who were studying nursing and began talking to nurses that I gained an interest in the profession. Also, part of the nursing shortage is due to lack of faculty with sufficient education to teach students. I hope to one day be able to share my experiences and expertise by teaching others who are in my position right now. I do not support mandatory overtime and think it is dangerous to both the nurse and the patient. If my manager ever asked me to stay past my shift due to being short-staffed, I would say yes, as long as I had the mental capacity to perform my duties safely. But if I felt that I was too fatigued, I would be honest and explain why I cannot stay. To avoid making medical errors, I will be sure to use the patient identifiers and 3 checks before administering any medications. If I ever feel overwhelmed while working, I will ask a coworker for help or notify my nurse manager. Providing optimal care involves teamwork, and each healthcare worker's role is important. In clinical, I have noticed that when the nurses get stressed, they do not hesitate to ask for help, and the person asked is happy to help. In 3 years, I would want my patients to describe me as empathetic, a strong communicator, and responsible. I want to be described as empathetic because I want my patients to know that I'm there for them and can understand what they are going through rather than feeling sorry for them. I want my patients to feel comfortable with me so that if they had any concerns about their condition or treatment, they would ask me. It is comforting to receive help from somebody that you believe understands what you are feeling. So I hope my patients see me as a person that is caring for them because I want to help them and not just because it is my job to do so. I would also like to be described as a strong communicator because I know what it is like to go to the doctor and be told things that I have no idea what they mean. I would never want my patients to be overwhelmed by what I am saying because they cannot understand me. Patients are already vulnerable when they are in the hospital, and to relieve their anxiety, it is best for them to have a good understanding about what they are there for and what to expect. At my surgical rotation, an elderly woman was so nervous for her procedure, she could not think straight, and the nurse did an excellent job in calming her down by explaining the procedure in a simple manner. I want to be able to do that, as well as effectively communicate with the patient's family members and my coworkers. I would like to be described as responsible so that patients feel safe when I am caring for them. Patients expect nurses to meet their needs and to do so in a safe manner. I want my patients to expect me to do my rounds often and administer my medications on time. I consider responsible people as being reliable and someone that I can count on, so I hope my patients view me as that in the future. That's it. Thank you for watching.